Thanks for joining us here at MSrelief yet again for a very exciting interview that we are hosting today in celebration of our official MSrelief launch. And so thank you for joining us. And I want to welcome our guest today is Christopher Alkenbrack. And Christopher was diagnosed with MS at the tender age of 24. Oh my God, so young. While he was still doing graduate work in linguistics at the University of Montreal, while he worked full-time for a Quebec charity. The diagnosis, of course, came as a shock, and Christopher wanted to let go of his girlfriend, not wanting to hold her back from her career. Oh, can I feel that pain? But Claire told him he wasn't going to get away that easily. Like a woman with spirit. Christopher and Claire were engaged in July of 1992 and married in October of that same year. They have 2 children. Nick is now 17 and Leah is 15. Christopher went on to a career in secondary as a secondary school teacher, then as a school board consultant, and as a school principal. And in 2001, MS reared its ugly head once again. That is a phrase I used myself, Christopher. It reared its ugly head with a series of debilitating attacks that left Christopher unable to work as of effective 2003. And it was at that point that it became clear that the MS had transitioned from the relapsing remitting into the secondary progressive stage that many people understand. In spite of attempting several of the current pharmacological treatments for MS, including 2 of the immunomodulatory injectable drugs, as well as an immunosuppressant chemotherapy treatment, Christopher's MS continued to progress. Then in 2009, Christopher heard of the new theory called the chronic cerebrospinal venous insufficiency. And after being tested for CCSVI, so much easier to say, he was tested in Canada, and then he sought treatment in Poland of all places. Well, we want to hear about that. So he went out to Poland in May of 2010 and had the treatment. Christopher is currently volunteering as a board member for one of Canada's newest charities, the National Chronic Cerebrospinal Venous Insufficiency Society, CCSVI Society, or the NCS for short, and that is at the www.nationalccsvisociety.org. Welcome, Christopher. Wow. Quite a journey that you've been on.
Oh, it's been a bumpy one sometimes.
We look forward to hearing things from you. Tell us, we've got so many questions. What were the exact symptoms that got you interested or fearful or into the doctor's office to find out what was going on?
Well, it all started in March, April of 1992, and I was perfectly healthy at the time. In fact, I just got back from a hiking trip with some friends in the Adirondack Mountains.
Wow.
And all of a sudden, I started to feel numbness in my hand, and I thought it was carpal tunnel syndrome. And so I just thought it was okay, it's either that or a pinched nerve or something like that. And then the numbness started in my foot and started moving up my right leg. And I moved, I went on a trip to Ontario, and it was Good Friday, and I remember going to church with my wife on Good Friday for the Good Friday service, and I was standing up holding a hymnal, and I lost my balance and almost fell on the woman next to me. So I knew something was going wrong. The following morning, I went into a clinic, a walk-in clinic in Ontario, Kingston, Ontario, where I was visiting. And from there, the young doctor told me, this looks like the possibility of an onset of multiple sclerosis. And she recommended that I see a neurologist in Montreal upon my return as quickly as possible. And so over the course of the weekend, I developed really bad double vision. And the images were not just inches apart, but sometimes feet apart, and were more obvious in my left field of vision. So needless to say, I couldn't drive back to Montreal. And I ended up back in Montreal with some friends. And I was sent to the Montreal Neurological Institute. And from then, I had a spinal tap, a neurological evaluation, and an MRI. And when I met the neurologist 6 weeks later in his office, he told me, Mr. Alkenbrack, I knew you had MS within the first 30 seconds of seeing you. He said it was a classic example of the weakness, the paralysis, the double vision, the gait problems with walking, instability, etc. So that was my...
Let me interrupt you and tell me, what did you know about MS when they started talking about it?
Nothing. And of course, I looked at MS as being, well, everybody ends up in a wheelchair. And because many of the fundraisers that the societies do, they'll use people in wheelchairs, maybe to create more sympathy and things like that.
Right.
So I found out years after my diagnosis that my one sister had also been diagnosed with MS. But she never told anyone.
Oh my.
She was a nursing student at the time. And she has a benign form of MS. She's had it for over 30 years now. And she's doing very well.
That's awesome. So tell us, Christopher, if you'd never even heard of MS or you didn't have a grasp of what it was, and just from your initial symptoms, the doctor told you that he thinks you might have a neurological condition like MS, that must have just put your world into a tailspin.
Absolutely. I went home that afternoon, actually, before I had even seen a neurologist, and I took out some medical books that my mother had in her home, and I started looking through, what is MS? What is MS? And I thought, oh no, Lord, please, not me, I don't want this. I'm just starting my career, I'm starting my life, And I held that information back from Claire. And it was only the following week when I was told that I had MS, that I said to Claire, okay, honey, I love you too much, you're free to go. Mm-hmm. And like I said, like you mentioned in the introduction, she laughed at me and she said, you're not giving away that easily, honey.
God bless her. Yeah.
Yes.
And so in terms of your relationship with your family, do you feel that that's changed at all, for better or worse, or not at all?
Well, I have several brothers and sisters, and I'm the youngest of 10 children.
Wow.
So
good Catholic family.
Kind of felt sympathy for me. My one brother did actually come to Montreal when I was diagnosed. Didn't really change the relationship. Not particularly, because I continued living a pretty normal life for the next 9 years. Mm-hmm. I progressed and became a teacher, then a board consultant, then a principal for the last 6 years of my career before I had to stop working. And so my relationship with my family didn't really change at all.
So what medications did you get on right away?
Well, back in 92, there were no medications available.
Okay. Oh, right. They didn't come out till 95.
Mm-hmm.
That's right. So. Right.
Yeah. I think the testosterone came out in 94.
Okay.
But, well, I'm male, so we don't run after doctors. Mm-hmm. And I went, I think, 7 or 8 years without seeing a neurologist.
Wow.
And for me, it was like because I couldn't see everyday symptoms happening, I just thought that I wasn't progressing.
Right, right.
And yet, 9 years later, when I had another MRI scan, the lesion load had increased dramatically.
Yes. So you learned that you can't judge your progression of the disease by the symptoms.
Absolutely. Because it's an insidious thing, and in that quiet time, it's continuing to progress nevertheless.
Right, right.
And even while it's in a quiet time, if the progression is very, very slow, it's very easy for us to tell ourselves that we're not sick enough to justify learning how to self-inject.
Absolutely.
Right.
Yeah.
And even for the visual problems, which I've often had from day one, every time I would see double on a hot summer day, I would just say, oh, my glasses are poorly adjusted or something like that. I would always find a reason to downplay the MS.
Yeah.
So then when you did start doing pharmaceuticals, what have you used? I'm curious.
I used Copaxone for the first few years, but I continued having some pretty bad attacks during the Copaxone. So the neurologist changed my Copaxone and put me on Rebif. And I did Rebif for quite some time, but I developed an adverse reaction to Rebif and stopped taking it for a couple of years, and then went back on it in January of 2007 for 2 more years. But the MS kept progressing, and that's when the neurologist told me that my only option would be mitoxantrone, which is a chemotherapy immunosuppressant.
How did that help?
Well, I only had one treatment, and they do a cardiac function test before you start the treatment.
Right.
And after one treatment, I got a call from the nurse saying that the cardiac function had actually already declined.
Okay. So that was out.
Wow. That had to be a little bit scary.
Well, it was, because I placed my faith in this treatment thinking, well, I guess that's the end of the road for me.
Right. And so all of a sudden now they tell you that this last hope isn't going to work for you.
That's right. It was scary.
That was a tough place to be in.
And my children were 15 and 13 at the time. And we've always discussed all of my treatment options with the children. They were always involved in making the decisions. I would bring all the literature and explain it in the simplest terms that I could for them. And, you know, they're very intelligent kids, and I appreciated their input. And all they wanted was a dad that could continue doing the things that I had always done with them.
Right.
I love the way you included the whole family in the decision-making, Christopher. So many parents choose to not share, trying to protect their children. But in many ways, you empowered your kids to be part of the solution. And that's really cool. That, you know,
and I think we underestimate many times
the
input that our kids can give, and the insight that they have, and the empathy that they develop toward other people who are sick as well. I think that's important. And growing up with a parent who's sick all the time, they develop this amazing consideration for other people who are sick.
I've seen that so many times over the years with my clients. Yeah, fabulous.
So what led you into looking into the CCSVI?
It was the Sunday, the show actually aired on Friday night, I believe, and it was the following Sunday that my sister sent me the video link to watch it. And my daughter and I sat down and watched it. My wife was in Montreal actually that weekend, so she wasn't there. And so my daughter and I are watching this, and I'm like very skeptical because I've seen so many things go by over the last 20 years.
Yeah.
Another treatment for MS. You know, it didn't really impress me. It did answer a couple of questions that I had always thought about, the vascular component to multiple sclerosis, because I had read a lot of neurological journals and the work by Charcot, the French neurologist, and knowing that all MS lesions are periventricular always intrigued me. And it answered these questions. It also answered the question of why do we have iron deposits in the brain of MS patients?
Right.
No other theory had ever explained that. So, with skepticism, my daughter and I watched the show the first time, and it was the second time that I was watching it a few hours later, and Leah came over and she put her arms around me and she started to cry. And she said, "Dad, this might help you. And we're going to go to Italy." And because, of course, we knew nothing about where this would take us and so forth. So in her mind, in her 13-year-old mind, she thought Dad's going to go to Italy and get treatment with the Zamboni tube, which, of course, didn't happen.
Darn it.
Over the next couple of weeks. Well, first of all, I did an interview with CBC Television. Because I had been I was the president of the local MS chapter here in Nova Scotia, in the Minneapolis Valley. And so I was contacted by CBC, asked if I wanted to do an interview. And I wasn't interested in going on television at that time. And my wife said, "Go for it." And I said, "Only if you come, Claire." So we did the interview, and that was on November 27th, 2009, and it got picked up nationally, and my story went national.
I love it.
And that was a time when I was contacted on Facebook by somebody I didn't know. I received about 50 Facebook messages following that interview.
Wow.
Thinking, you know, who are these people? Why are they here? And I ended up making a friend that we actually went to Poland together for treatment on the same day. And she arranged for me to go to Montreal, and I went for the Doppler scan to see that I had this condition. I wasn't going to go travel overseas if I didn't have the condition. So I went to Montreal. We actually left Christmas Day of 2009. And I had the scans. I had an MRR and MRV. And they told me that it was very sure that I had CCSVI. I had these blockages in my veins. So from there, it was a journey to try and find better health.
So how did you end up in Poland, of all places?
Well, they were the first person that answered my emails and gave me a date. There were clinics that opened in the States following the confirmation of my date for Poland. But I wanted to really go for the first place that contacted me, and they had already done more than 300 or 400 procedures at the time.
Wow.
I spoke with a couple of Canadians who had been for treatment in Poland at this very clinic. And I spoke with a woman from Switzerland. I phoned her in Switzerland, and she told me all about her experience at this clinic in Poland. And so I said, I'm going to give it a try.
Good for you. Wow. And how did you handle all of the ridiculous media and social media attention that came along with the CCSVI issue?
At one point, it felt almost like having a full-time job for trying to answer all the emails. And I realized I don't have to answer every email personally. And I I felt, especially before I went for treatment, I was getting sick. I had a really bad attack that I couldn't even transfer from my bed to my wheelchair by myself anymore. My son had to help me, and that scared me. I thought, is this the biggie? You know, am I going to only go downhill from here on? And so from there, I did several interviews on the radio and television and so forth. And I didn't seek this media attention. I've never really sought to have my life story out there. I'm just an ordinary guy with MS. And yeah, sorry, I've got my pooch there.
Oh, cute.
This is Mo.
This is Mo?
She's been on several interviews with me too.
Yeah.
So I'm okay.
Hi, Mo, adorable. I'm sure Dr. Zamboni didn't anticipate all of the hoopla that he got either.
No, absolutely
Oh
not.
my goodness. So, how are you feeling since the procedure?
Well, I noticed almost immediate effects after the procedure. I was left with a lot of what we call brain fog in the MS community, and my fatigue was overwhelming. I was sleeping anywhere from 12 to 14, 15 hours a day just to be able to manage. And I was using a wheelchair by afternoon. I would use my wheelchair just to save energy. I didn't have the energy to continue and do full days. I had used a pair of forearm crutches since 2004 to get around, and I had stopped driving. My vision was bad. Some of the things that I improved fairly quickly was the ability to walk, because my balance had improved so drastically, and really overnight.
Wow.
You know? And I mean, we hear often, you know, it could be the placebo effect. But I really didn't care what type of effect it was.
No, definitely.
I was glad, you know, and the placebo effect's a real effect, of course, and we can't downplay that. And it's often, you know, with MS treatments.
So, Christopher, is the MS still active in your body?
Well, I've started to decrease already. I found many of the symptoms that went away or were at bay for several of months, they've started to come back a little bit. The fatigue is coming back.
Sorry, have you had another MRI lately?
No, I will have to go out of province for another MRI. They don't do a lot of MRIs in Nova Scotia. I have friends that have waited up to 15 years between MRI 1 and MRI 2.
Oh my goodness.
So it's not part of a regular follow-up here. There has to be a specific reason to do an MRI. But I will probably go back to Montreal soon to have another MRI done.
So, one more question. Are you taking any MS pharmaceuticals right now? Okay.
I've done a lot of other changes.
Tell us about those.
For the last 5 months, I've been on a gluten-free, dairy-free, gluten-free diet.
Oh, I'm going to follow you in this one, starting the 1st of April.
Oh, perfect. And I found that initially the energy levels went up. And I questioned a friend of mine who's a doctor who has MS himself. And he said, well, that's normal because energy required to digest gluten-free products is less than that required to digest gluten. Therefore, the energy spiked very quickly.
I love it.
How long have you been on the gluten-free diet, Christopher?
Over 5 months now.
Fabulous.
And I've lost a couple pounds too.
Excellent. And did the increase in energy that you noticed, did that maintain?
Yes.
Wonderful. Wonderful. So, is a wrap-up question here, Christopher. How has the whole CCSVI experience affected you and your family? are you, at this point now, are you stepping back? Are you glad you did it? Do you have regrets? Would you do it again?
I have zero regrets. I often say to people that I've had the best year and a half, or it's been 22 months now since my procedure. I've had the best 22 months in the last decade of my life. I did things that I would have never have imagined doing. I went horseback riding with my daughter, not last summer, but the summer before.
Nice.
It wasn't something that I ever dreamed of doing again. And my daughter said, "Dad, that was the happiest day of your life. I've never seen you smile so much."
Oh, she's going to remember that moment for the rest of her life.
Absolutely. And it is difficult to see some of the symptoms coming back after initial improvement. Would I go back for a second round? Many friends have. I've decided to wait for the science to catch up to the practice. But would I go back? In a heartbeat, I would go back. I don't find that it was a dangerous procedure. And one of the questions I've been asked many times is, was it painful? And I said no. The most difficult part of the procedure was the fact that I had to stop talking for 8 minutes while they did my job.
Oh my God. Love your sense of humor, Christopher. And I'm so glad that you addressed that piece, because there's a lot of people wondering now, even people who have not gone the CCSVI route have started to hear that, well, you have one, then you're going to need more than one. And so it's interesting to hear, and I like the way you put that you're waiting for the science to catch up with the procedure. That was fascinating.
Yes.
Linda, any final questions for Christopher?
Nope, I think we got it covered.
Yeah, this has been wonderful.
I am very glad that you were able to take the time with us.
Oh, anytime.
Well, we will definitely have to have you back. Love your warm, cheery personality. And thank you so much, Christopher. And
It's been a pleasure.
Appreciate it. From Linda and I, this is Trish and Linda here at MSrelief. And we thank you for joining us, for watching this interview with Christopher Alkenbrack. Man who has proceeded to get the CCSVI procedure, and getting some feedback on him on how he's doing now. And we hope you're enjoying our MSrelief official launch day and in our videos. And stick around, there's another one coming up soon.